Begin the extraoral exam by seating the patient in an upright position. Ask them to remove any hats, eyewear, scarves, and fake mustaches. Begin by inspecting the temporomandibular joint. Palpate the TMJs with bilateral light pressure as the patient slowly opens and closes their mouth. Observe the path of the mandible as the patient opens and closes. Record any sounds or deviations from normal, as well as any discomfort the patient may have. Next, move on to the face. Palpate the facial tissues bilaterally using circular compressions. Have the patient clench their teeth together and palpate the parotid area bilaterally using circular compressions. Record any lesions, swellings, or abnormalities. You should not be able to feel any of these glands normally. Next, move on to the neck region. Place your fingers on the lower border of the mandible and palpate medially. Pay particular attention to the submandibular and submental lymph nodes. Have the patient put their chin to their chest. Palpate the preauricular nodes, the postauricular nodes, and occipital node areas. Have the patient turn to the right. Find the sternocleidomastoid muscle and palpate the superficial and deep cervical nodes. Then have your patient turn the opposite direction and do it again. Have the patient shrug their shoulders and palpate the supraclavicular nodes. Then place one hand on each side of the larynx, just under the mandible, and palpate the larynx and trachea. Palpate the thyroid gland as well. You should not be able to feel the thyroid. Then ask the patient to swallow and feel the larynx move. You may need to have them sip on water so that they're able to swallow. Then record any swollen lymph nodes, lesions, masses, or abnormalities. And that concludes the extraoral exam.